Hey everyone, my name is Amelia. Unfortunately, I can't be there in person today, so we will begin our exploration virtually while my amazing group members, Maddie and Molly, will be showing you live the structures on our female and male cadavers. To understand the orientations of the thigh and leg, we will dive into limb development first. A common question that has come up in our course is why are the extensors and flexors in opposite orientations, anterior and posterior, on the upper and lower limbs? Why are the muscles of the arm and thigh so different? This can be frustrating for students, as we've discussed, especially on exams, but the root lies during our development in gestation. As a fetus, the upper limb began developing during week 4 of gestation, with the lower limb lagging about 2 to 3 days behind. You can see the forelimb and hind limbs buds forming. Before week 8, our flexors and extensors are facing in the same direction on the coronal plane. The flexors face superiorly, while the extensors face inferiorly. If you look at this image to the right, you can actually recreate it yourself. If you place your arms in a circle and you put your feet together in the butterfly position, this is how you were floating in the womb. Now, with your arms and legs in this position, this would be the fetus's orientation prior to week 8. Notice how your flexors would be on the inside of the circle, while the extensors would be on the outside of the circle, and we're just waiting to medially rotate. However, at week 8, big things begin happening. The limbs begin rotating into a parasagittal orientation. However, the step that decides which flexors and extensors face anteriorly is when the limbs rotate along their longitudinal axes. The upper limb rotates laterally 90 degrees so that the elbow points caudally, while the lower limb rotates medially so that the knees face cranially. Anterior compartment of the thigh as an example, we can observe that this rotation has moved the extensors to the anterior side after that medial rotation. Most anteriorly, we can identify the rectus femoris. Laterally to the rectus femoris lies the vastus lateralis. Medial, the vastus medialis. Now, by reflecting the rectus femoris, we can see the vastus intermedius just deep. These muscles form the quadriceps femoris, inserting distally to the patellar ligament, causing extension of the knee. Posteriorly, in the posterior compartment of the thigh, we can identify 3 critical muscles of knee flexion. Medial to lateral, we have the semitendinosus, the semimembranosus, and the biceps femoris. Together, this group of muscles inserts onto the heads of the tibia and fibula, allowing for flexion of the knee. This orientation was all made possible by the medial rotation of the lower limb. Maddie and Molly will now show you these muscles on our cadaver and a dive into some more topics related to these regions. You may have already noticed, but to the right is a continuous diagram showing limb elongation and rotation for reference.